Well, there are lots of new data coming in suggesting that COVID patients with underlying heart conditions specifically have a significantly increased risk of dying.
Yeah, to break all this down, let's get to Nicole in the newsroom with Dr. Soffer for Insight. Nicole.
Louis, thank you, Dr. Soffer. Thank you for being with me here today. And Doctor, I want to start with, I've been reading a lot of coronavirus patients are rushing to try these experimental drugs, but we are also seeing the amount of deaths increasing in patients and elderly patients with underlying conditions. So what risks, if any, do these experimental drugs pose in those elderly patients with those underlying conditions?
It's a great question. It really depends on which experimental drug that we're talking about. The hydroxychloroquine, azithromycin combination has real risks in cardiac patients, and we can mitigate those risks, so we have to know about them. So my suggestion to my patients, and we're seeing a ton of televisits, and I think a lot of my colleagues are doing that as well, is to go over it with them before it happens, to try and mitigate or reduce those risks if they need any of those experimental medications.
Doctor, if the drugs are not suitable for a particular patient, what are their other options?
Well, I think that the cardiac patients are known in increased risk. So there's a study out of Wuhan actually that showed a very clear increased risk for patients, about 20% more than general coronavirus patients. So what we got to do is make you not an active cardiac patient. So get your blood pressure under control, get your heart rate under control, make sure your medications are working and optimized so that if you get hit with the coronavirus, you're not at that increase as much as 20% increased risk of real problems if you get it.
Wow, that's interesting data there. Thank you, Doctor, so much for answering all of my questions. Christy and Louie, I'll send it back to you.
All right, Nicole, thank you. And now on to a